Welcome. My name is Unity Stoakes, co-founder at Startup Health. Today, I get to have a conversation with longtime health transformer Victor Penev, who is the CEO and founder of Edamam. Edamam is democratizing food data and has really been a leader of our food as medicine moonshot from day one at Startup Health, longtime OG health transformer in our community. So we're going to be getting a full update of all the exciting things. They've got some news to share around a new AI meal planner agent that they've announced, as well as a vision API to provide accurate nutrition for photos of meals. Stick around. Victor, how are you?
Good. Hey, Unity.
It was great to see you at Health in Vegas. How was it for you?
Yes. Oh, it was the best health ever so far. I think it's just years of going pays off because now you know a lot of people, you know how the thing goes. I had probably 50 meaningful meetings, probably 20 of them would eventually become business, and maybe two or three will be right away. So it was quite good, quite good.
You're
Definitely.
jamming in it. It's always great to have you in our Startup Health Pavilion there because then we get to just bump into each other and talk in between all the meetings and see you. You have so much momentum. You've got a lot of news to share. And why don't we start with you reminding everyone what Edamam's vision is and what Edamam is doing for the world?
All right, I love that question. So the vision is, well, the mission is to organize the world's food knowledge so we can help everyone make the right food choices and eventually live long, healthy lives. It is driven by that belief that can live up to 120 years without chronic conditions, without mental illness. Prevention is the name of the game, and that food is an instrumental part of that lifestyle change that people can do to live to 120 years healthy. And so we ended up focusing on organizing the world's food knowledge so we can make this happen, actually help people in everyday decisions to choose the food that's right for them, that they like, and that will help them live long, healthy lives. So that's the mission and the vision.
And
Eventually, we want to help everyone in the world eat the best way they can.
And what's great about that is everybody eats, everybody does
Right.
it from hopefully from the day they're born through that 120-year mark and maybe longer. You have been a longtime health transformer. You're an OG in startup health in our community and ecosystem. This is not a new mission for you. You have been on
No.
this journey for some years now and have just been a really early innovator and really at the forefront of now what's known as the food as medicine ecosystem, and we have a food as medicine moonshot. I think back when we first met you, there was only a handful of companies and people even focusing in on this area. Bring us to the present day. What are you seeing? What's changed in the category that you're in? What are you noticing?
Oh, lots has changed. I mean, as you said, when we started, we were very few of the technology companies that were talking about food as medicine and whatnot. There were obviously influencers and people talking about it. Companies that wanted to solve the solution with technology, there were not that many. So what's happened is a lot of mega trends that are converging to a moment where the thing is going to become reality. First and foremost, I think it's AI because it is allowing true personalization in an intuitive manner. And this is something we are focused on building. On top of our data, we have a very unique data set, probably the largest data set of food and nutrition in the world, very accurate, something that we can leverage. And with AI, we can drive that through personalization. So the emergence of generative AI is an important trend that is driving that process. The second is, as you mentioned, food as medicine has become a thing, right? Now people talk about it, people try to build around it, and there is actual business model, Medicare, Medicaid, reimbursing for medically tailored meals, medically tailored groceries. And once there is a business model, people flock into it. So there is a momentum around there's a cottage industry of companies that are working on food as medicine. And that is very important because once money is in the pot, then it's a lot easier to create business models. And related to that is the consumer awareness, right? People are a lot more aware now about the impact of food on their health and well-being. Part of it was driven, unfortunately, through the COVID pandemic and the fact people realize that lifestyle is an important factor when you get infected. Part of it is the whole conversation around longevity and wearables and ways to measure with CGM and all that stuff. So all of that is essentially bringing up consumer awareness. So people want to know what they're eating and how it impacts their health. And then last but not least, it's a little bit out of left field, but it's GLP-1. So GLP-1 is what I call a gateway drug for us because GLP-1 requires companion diets. And this is something that we excel with, recommend what people should eat, meal planning, meal recommendations, leveraging a lot of data, detailed data. And this is what we're doing. And once GLP-1 breaks through, that is true for all the other chronic conditions, whether you have diabetes, Alzheimer's, kidney disease, etc. Diet is important, but the adoption of diet alongside chronic condition management was more kind of people were paying lip service. With GLP-1, they're actually doing it because people are saying, look, I need to maintain muscle mass, not to waste away. And so food becomes an important element of the treatment. And we think that GLP-1 is going to change the way people think about food alongside chronic condition management. So those are the
And you
four
you
trends.
just yeah, those are major trends and they're all converging. And what's so interesting is you were very prescient in that you were building and organizing this food data base that years before, and now it's becoming so useful and so relevant. In fact, you had announced some news recently about how you're using AI as part of a meal planner agent. Can you talk a little bit about what you announced and how that works?
Yeah, absolutely. I'll get into the details, but just as a background, AI, as I mentioned, helps with personalization. It also helps with intuitive interaction for people. So it has the potential of driving behavior change, which is really key. But for the AI to be effective, it has to leverage data. And this is where we come in. We leverage our data, our brand, our customer base. And what we are building, what the long-term vision is something that Edamam has always wanted to build is personal virtual nutritionist, something in the cloud that knows you very well, is available 24/7, knows contextually what you like, what you dislike, what your price point is, what allergens and diets you have, what medication you're taking, and can contextually help you eat, recommend meals, remind you to shop for this item, not that item, realize that you're in a restaurant and recommend a meal from there. So this is the long-term vision. Now, what we're starting with is a much more granular approach with an AI meal planning agent. So this is an AI-based agent that allows personally to have a conversation with you, really understand who you are like a dietitian, and then be able to recommend a meal plan. And after this first agent, we'll be building other agents like food logging agent and nudging agent, etc. And we'll orchestrate them and help them work all together. So essentially, we'll build a virtual nutritionist that is personalized to you and is there for you at 2 o'clock in the morning. If you say, oh, I just ate this big pizza and I shouldn't have, but what can I do? And it will gently push you in the right direction and suggest things to do the next day. So this is what we're building. The AI meal planning agent is something that we've launched recently for beta testing. We're also leveraging AI in other ways. We're doing automated food logging with images, so you can take a photo. Now, AI allows very good recognition of the image, and then it calls our nutrition analysis API, so we can produce all the nutrition data. We've also used AI to create a data set of recipes that represent the most commonly eaten meals around the world, which is a useful data set. So we are leveraging AI in lots of different ways to improve our data and provide better experiences for our customers.
So you mentioned a key word earlier in the conversation, business model, and you just said the word customers. Is describe this how everyday people get access to this. Are you going direct to consumer or is it more B2B to C? What is your business model? And then how do people get access to using these amazing tools you've created?
Yeah, so we are a B2B company. And generally, we provide access to our data. Basically, we sell data. And we provide it through APIs or as licensed data sets, and our customers pay based on the volume of data they consume, either on a monthly or annual basis. Right now, the business model is if you go and sign up for the API, you put a credit card in, we charge you at the end of the month based on the how many requests you have to the API. Or if you license a data set, we'll charge you based on the number of data points. Now, with the AI meal planner, things will change a little bit more. We'll charge per user per month, so it'd be a slightly different business model. And for the first time, we may actually provide user interfaces. Right now, we don't provide user interfaces. Our customers build it. But for the AI meal planner, there's an expectation that there's a minimum product, and so it'll be chat and voice. We're not going to build avatars or integrations with notification systems or smart refrigerator visualizations and stuff like that, just chat and voice, but we'll do that. But we are staying on the B2B side. We're not going to sell to direct to consumer. The AI agent will have an API itself. We think this is where we're going to make the most difference when we actually reach the customer through the places that they are already in, whether it's Walmart or the dietitian office, or it is in a green market or restaurant, whatever it is. That's our vision.
That's great. And that enables you to be through multiple channels and in a lot of distribution sources that this will start to show up and people will get access to these tools in that way. What else does the world need to know? You mentioned that you've been doing tons of meetings, you've got lots of new partners coming in. Who are you trying to reach today? Who are the types of partners, the people that should be reaching out to Edamam, and whether those are business development relationships, strategic relationships? Who are you trying to meet?
Yeah, we are always open to partnerships around content and data, but for the most part, I think we add the most value to companies that are trying to implement diet as a form of their product mix. So those would be companies that are doing corporate wellness, population health, chronic condition management. Ultimately, I think insurance companies would be very interested in our product because if people eat right and become healthier, the whole equation about premiums works out a lot better. We've started some conversations with insurance companies as well. And there are some companies that are not as traditional in the healthcare space, like grocery stores, for example. Personalization, healthy eating has become a thing. So those would be the other ones that we would love to talk to. So this is the category of what we call big companies that are already transacting directly with consumers. On the other end, we're seeing quite a lot of interest from app developers. People are just building applications around healthy eating, whether it's a meal planner, diet management, they're serving, I don't know, a community of vegans or keto, whatever it is. And they're all using our tools for that personalization. So to some extent, this is also out there for them because the innovators are in their midst, right? Those are the young, small companies that eventually are going to become a big company. And so we try to help everyone equally. And we've seen recently quite a bit of growth, 15% month over month in our API usage, specifically from smaller companies that are interested in building applications on top of our APIs.
And as you mentioned, one of those four trends with the GLP-1s, this, and as well as food as medicine being at the top of so many discussions today, it's just a whole different world from 3 years ago, 4 years ago. One of the things that I think you continue to do well, and I know you're an entrepreneur, a serial entrepreneur, is how quickly you adapt, how quickly you evolve and stay ahead of the innovation curve. AI has really opened up this window. It seems like there's companies today who are quickly, almost like in the mobile revolution, quickly understand, hey, we need to be mobile first. Companies and startups today are realizing we need to be AI first. What's your thoughts on that? How have you taken that to heart? It seems like you've really done a lot quickly in terms of thinking in that way and designing this as core elements of your strategy and product for the future. But how do you think about the moment we're in, the new, let's call it the post GPT world of AI? How How are you doing this for Edamam? And what would your advice be to other innovators out there that are maybe haven't gotten the memo yet?
Yeah, I would provide a nuanced answer to that. So AI, without any hesitation, is going to change how the world works. So people are just interacting differently with technology. And it feels actually not as much as the mobile revolution, but more like the advent of the internet.
Yeah.
It is a different way to interact with technology. So you should definitely do something about AI. Now, what you do really depends on who you are, what your business model, and that's where the nuance in my answer comes in, because AI is ultimately just a tool. It is a super powerful tool. I think for us, it made our vision, a 50-year vision, a reality now. We always
Right.
thought we're going to build a personal virtual nutritionist, but we didn't have the tools to do it. Now we can do it. But that doesn't mean you have to apply AI across the board. It still has problems, quite a few. And there's obviously the utopian future area. AI is going to take over everything and it's going to solve all the medical problems and nuclear fusion and all that stuff. It's great. And there's also dystopian future. It's going to take away all the jobs and robots are going to kill everyone. I think the truth is neither one of those. It's somewhere in the middle, but you need to really evaluate what your core value proposition is. And for us, it's actually data, right? So we're not moving away from that. We are a data company. We started building data set, organizing the world's food knowledge, it's data, and we focus on data. AI is just a better way to present this data. And not every business problem has as a solution AI. Sometimes you just need to use humans or you need to use traditional machine learning as opposed to generative AI. You find out what the problems are and then go for it. I think very realistic view of what AI can do. So you need to educate yourself, you need to educate a team and be realistic of what it can do and when it's best to apply it versus not apply it. And then go and actually do it. If you just say, oh, I'm going to wait, you're probably going to get swept away. Everybody else is adopting it and they will create better interfaces, better usage and whatnot. So you don't have the luxury to wait. On the other hand, don't go head first into that because most likely you're going to end up with technology that doesn't work as expected just because it's so hyped out. So it is a balancing act. You get to find like the middle point.
Yeah, and there's also AI is such a generic word, right? There's tools that you just use to make your business and operations more effective, more efficient, advance your programming team, your engineering team, etc., maybe your marketing team, just for how you're building your business. And then there's AI in terms of your product and solution innovations, which are a lot of the things that you've done, which is integrate. You basically push your roadmap forward by decades, right?
All right.
By taking this awesome platform that you already had and the data and now supercharging it with these offshoots of really novel things that 3 years ago wouldn't have made sense yet. So you're innovating inside your business as well as on your product. And I think it's important for large and small companies to be thinking that way. So as we think about AI first at Startup Health, it's from a multi lens approach. Like, how can this make our operations, our team, our business more effective immediately?
Right.
And then how can it make our solutions and products and services more effective? So it's a dual approach here. Are you optimistic today? Where's your view? I mean, it's such a wild time to be looking at these four intersecting trends and within the context of food is medicine even being a thing, right? This must be satisfying to you because you were one of the early people, innovators focusing on this, trying to get other people to even listen to this as a concept. So, what's your perspective today, seeing that this is a political topic, it is a business topic? Everyday consumer and retail companies are talking about this, technology companies, startups. How do you feel about where the market is and the advancement of the category?
Yeah. Look, I would answer that I'm a long-term optimist. I think those mega trends are going to continue, and long term, we will have really good solutions for how people to eat better. And we hope to be part of those solutions and power with our data, many of them. Short term, things will be very turbulent. And I wouldn't be honest if I say I'm 100% optimist. There's a lot of things that can go wrong. AI may disappoint in the way it actually presents. So it may become actually expensive with reasoning models becoming more expensive with tokens and stuff like that. There might be some pushback in terms of the business model of Medicare and Medicaid reimbursing. If they get budgets cut, et cetera, who's going to step in? I think that will eventually get a result, but the market might be in a bubble. And if it slumps significantly, lots of budgets going to get cut, and that will impact business. So there's a lot of things that will be turbulent in the short term, and I hope for the best. I'm always an optimist. I can't be an entrepreneur without being an optimist, right? You always have to have a little bit of the rose glasses on and believe that things are going to
It's
happen.
the only way to get through the day, right? I mean,
Right. But I'm also a realist. I understand that there are a lot of threats, and then you should have, I guess, a strategy of implementation that allows you to have a fallback. If something goes wrong, what's the fallback? For us, the fallback is data in that database that we've built. Even if all of it fails, we still have that data on which to step on. So the short term, I'm ambivalent because of all those things that are happening. It's an insecure world, but long term, I think the trends are unmistakable. Food is medicine, consumer awareness, the way to treat and prevent disease, AI becoming, I think all those are going to survive. And I think in 5 to 10 years, we'll live in a completely different world.
it is a messy, chaotic time, but you can see as we get through this as a world, as a community, as innovators, as health transformers, it does seem like a lot of opportunity and possibility through the other side of it. So thank you for being both a long-term optimist, but also a pragmatist and realist, because I think that balance is key in terms of building things that are actually going to make an impact and solve real challenges. What else? What did we miss? What does the world need to know about Edamam and everything going on in your world today?
I think I touched on that, but I think that what is important is that notion of the personal virtue nutritionist, and that if we actually are successful at executing that, we'll be able to really help billions of people in their everyday choices because they're real impediments to people eating well. It's their budgets, it's convenience, it's not being able to make the decision on the spot. But if we can lower the price of a personal virtual nutritionist to something that's affordable to everyone, as opposed to $100 an hour, $150 an hour, and it's always available to you and it nudges you at the right moment, you will see actual behavior change. And what really excites me is that opportunity that we can actually change the lives of people and really move the needle towards that 120 years without chronic condition and mental illness. That's the big ultimate goal. I don't know if we'll succeed in our lifetimes to get there for everyone. For some people,
Well, with people like you, we'll push it forward. I don't know, this is off topic, but it's such a weird time right now. There's a lot of people on SNAP and food programs who aren't getting access to food today.
right.
And as you mentioned, there's a lot of different layered issues in terms of economics and people not being able to afford healthy food. I don't know if you have any thoughts on that. I was speaking with my mother last night, and we grew up on food stamps. We were on a program called WIC, Women, Infant, Children. So these programs like kept us going, just having access to food. And I think there's also a lot of efforts to make sure the food is healthy that people are getting access to, whether that's in our schools, whether it's through these food stamp programs or food programs. I don't know if you have any thoughts on, are people of all economic levels going to get access to the food knowledge and food databases that you're talking about?
Yeah, so I have lots of thoughts. That's a whole different conversation.
It is. I took us way down off topic here, but
Yeah,
I'm just curious, just
I'll tell
because
you.
we're at a point where tens of millions of people are at least temporarily not getting access to their subsidies right now.
Yeah. So food security is different than healthy food. They're adjacent topics. And if you think through the lens of people living healthy for a long period of time, food security is where you start. You have to have food before you optimize it. There is structural problems in the way the modern world has developed with relation to food. So there's, apart from the food industry and the healthcare industry, there is also the agriculture industry. The business models so far have been such that food that is cheap tends not to be very healthy in general. And so even if you guarantee people some access, they may not achieve health goals. The obesity epidemic is not abating in any way, shape, or form. So I think the bigger issue is that we need to transform not only the way people eat, but we need to transform how food is produced. So the agriculture industry needs to be
Yeah.
transformed. The food industry needs to be transformed. How is it transported? I'm very optimistic there because there's a lot of technologies there, both in smart farming, making business models work for regeneratively grown food. There is things in terms of lowering the price for delivery to people, but also long term. Short term, I think food security is important. It needs to be taken care of because if people don't have to way to eat, they're not going to be healthy anyway. So there's got to be some food on the table. But long term, we need to solve all those problems. Ultimately, people will benefit from the data regardless, because there's simple daily choices that you can make even within a certain price point that can make you eat a little bit more healthy. So for example, if you're, I don't know, from Puerto Rican heritage in the Bronx, living in the Bronx, and you're used to going back from work and just getting Happy Meals from McDonald's or getting something from the local store that is on stamps, you may not think, and that this is actual fact because we work with that population, people don't think about their heritage and about that rice and beans is a very healthy dish. And it's just as expensive as getting anything else, but it is not part of their mindset anymore. So
Yeah.
just reminding people, hey, this is your heritage. This is what your
Yeah.
grandma used to eat. Get some rice and some beans and cook it for the week. That actually changes the health profile within the same price point. And I think data and knowledge of a person can actually help educate them in their choices and push them in the right direction. So I'm hopeful that we can help everyone.
Well, thank you, Victor, for everything that you do. We need more payers to be using this data. We need the tech companies to be using this data. We need the grocery stores to be using this data, and all the innovators and startups, so that we can get access to more people, get more people can get access so that they can eat healthier and be healthier. So thank you for everything that you're doing, Edamam, and it's great to see you again.
Yeah, thank you, Unity. It was a
All
great
right.
conversation.
Talk
We'll talk
soon.
soon. Bye.
And finally, an invitation to all of the extraordinary health transformers, whether you are a startup, someone building the future of health, or whether you are an investor, funder, or buyer of the solutions out there in the marketplace. This is an invitation to you to join the Startup Health member community. Learn more at startuphealth.com. Look forward to hopefully seeing you soon.